我们就是还有一个演讲，我希望大家都能够留到最后，好不好？哈，不要因为我们有说4点半可以开始签退，然后我们把门锁起来好了，好的，不给大家出去。你太早离开了，你就没有赠品哦，哈。今天这个赠品其实很好的，你们自己看就会知道是什么啊。好，我们最后一位讲员是在线上，哈，待会儿会连起来。那我们最后一个演讲的引言人是我们台湾营养界非常尊敬的，可以称前辈吗？不会说老了哈，熟女吗？不是前辈，都是我们老师辈，是我们的老师辈的前辈啊，黄清珍教授。我想这边很多人不太年轻的，不是老师，我这样讲不尊敬，不是太年轻的不认识您，是他们没有机会认识老师。那个我们就叫老师，我们就不叫教授，因为这是我们的老师。黄老师在台大农化系的时代的时候，其实他就已经是台湾跟亚洲营养界的领头羊，因为他不但是，当然他一定是担任过台湾营养学会的理事长，而且他也担任过亚洲营养科学联盟的秘书长，而且从2015年开始，老师就一直是这个联盟的理事，所以他跟亚洲很多不同国家的这些营养界的这个学者一起为着怎么样让，我想应该是不止亚洲人嘛，全世界的大家的这个营养的工作来努力。老师虽然退休了，但是他的研究工作还是持续在进行。然后为了要提升台湾的营养研究，还有一些营养教育的推动，几年前呢，老师和一些志同道合的前辈们组成了一个应该是说建立了台湾营养基金会。那持续的在为着怎么样让台湾人民能够有更健康、更好的营养而努力。所以我们今天非常荣幸，对不对？这个辈分最重的。不是年纪最大，是辈分最重的放在最后面。好，热烈的掌声，不要睡着了哈！热烈的掌声，欢迎黄老师。
谢谢郭主任哈，我最喜欢来实践了哈。我第一次来实践教书，你们一定猜不到什么时候。民国67年，我当博士班1年级的时候，我来这里教，你也猜不到普通化学。所以跟这边的缘分结得非常的深哈。好，我们前面的3个演讲都跟钠和减钠和健康有关系。下面这个演讲我们要转个弯到另外一个方向去。好，那么过去我们在台湾10年来哈，尤其是我们在EOC Taiwan 里面就有注意到，我们渐渐走到高龄的社会，那么老年人的营养跟健康跟饮食需要关注哈。但是我们在那个时候关注到的一个口腔健康的问题，跟高龄化，我们主要的焦点是在咀嚼吞咽方面的事情就是口腔健康跟你的饮食跟你的健康的关系。但是我们过去从来没有注意到口腔健康当中的另外一端，就是你的舌头对于味觉的敏感度跟老年人的健康，有些年轻人也是有这个味觉的问题跟你的饮食跟健康有什么关系？那么去年12月我去参加世界营养大会ICN， 去年12月初在东京，我就注意到我们底下的这一位演讲者，他提到了这个 taste sensitivity 跟 nutrition 的关系。那我觉得这个演讲的内容很值得介绍到国内来我们过去从来没有注意到这个，所以我就推荐给我们的 organizer。那虽然我们没有把他请到台湾来，可是他同意在线上帮我们做这个演讲。好，Okay, it is a great pleasure for me to introduce to you our next speaker, Professor Shizuko Satoh-Kuriwada. Professor Sato finished her dental school program at Tohoku University and obtained her dental license in 1986。好，下面的这位讲者，他是一位牙医师。After finishing her PhD from the same program in 1990, she started her career as an assistant professor in the Department of Oral Medicine and Surgery, Tohoku University Graduate School of Dentistry. From 2020, Dr. Satoh-Kuriwada served as assistant professor of Tohoku University Hospital, Division of Comprehensive Dentistry, Department of Disease Management, Dentistry. From 2021, she served as Vice Director, Oral Medicine Liaison Center, Tohoku University Hospital. And her research interest was mainly on the taste, especially umami taste, oral health, and the overall health and nutritional status. Today, we thank Dr. Satoh-Kuriwada to give us this very valuable knowledge on umami sensing and nutrition across the ocean. Dr. Satoh-Kuriwada, are you there? Can you hear us?
Yes, I'm ready.
Thank you very much. So please start. Thank you. Let's have a big hand.
Yeah. Thank you, Dr. Howard, for introducing me. It's an honor to speak here today. I'd like to thank the members of organizing this symposium and inviting me. I'm a dentist. For many years, I have engaged in taste disorder treatment in Tohoku University Hospital. I'd like to talk about umami sensing and nutrition. Oh, excuse me, in a lab coat because I just returned from medical duties. Eating delicious is the joy of life. Moreover, through taste stimuli triggers, salivation, digestion, and absorption. Then taste sensing promote our physical condition. These are 5 basic tastes of food. Each basic taste sensing has a physiological role. Sweet sensing is a signal of energy intake. Bitter sensing is a signal to avoid poison. Salty sensing is a signal of mineral intake. Sour sensing is a signal to avoid ingestion of spoilage. While today's subject, umami sensing, is generally a signal to protein intake. Umami-presenting substances are included in cheese, vegetable, like tomato, broccoli, meat, fish, and shellfish, etc. Umami sensing is not only a signal of protein intake, but also has many other functions. I will talk about it. First, let's talk about taste disorder and umami in the elderly. Taste disorders are common in elderly people. Japan is aging at the fastest pace in the world. This slide shows the results of a survey conducted by the Japanese Oropharyngeal Society from 1990 to 2019 in Japan. It reveals that the number of patients with taste disorders has increased with aging. The number of patients with taste disorders was correlated with age up to 70 years. The age group with the highest number of patients was in their 90s. We conducted an epidemiological study and measured the taste threshold in the elderly using the filter paper disc method. Subjects' mean age was 80 years old. They were in healthy conditions in the homes for the elderly in Japan. The results are shown on this slide. As shown, 36.6% elderly showed taste disorders. It turns out that even elderly people who actually live in good health often suffer from taste disorders. What does it mean for elderly person to have no sense of taste? Patients complain that delicious cakes taste like sand or wax. Moreover, they complain, "Can you swallow sand or wax?" For that reason, taste disorders cause loss of appetite, malnutrition, and fall into nursing care. Taste disorder is one of a frailty risk factor for the elderly. We also surveyed taste disorders and appetite in the elderly. As shown in this slide, loss of appetite was observed in 3.8% of normal taste subjects. On the other hand, in 43.3% of the taste disorder subjects, taste disorder seems to be related to appetite loss in the elderly. Further, we surveyed taste disorder and physical conditions in the elderly. As shown in this slide, poor physical condition was observed in 5.7% of normal taste subjects. In contrast, in 44.88% of the taste disorder subjects, taste disorder seems to affect the physical condition in the elderly. Many researchers have pointed out that taste disorder leads to inadequate food intake. We investigated the intake frequency of each food ingredient in the elderly with taste disorder and with normal taste sense. A study by the Japanese National Center for Geriatrics and Gerontology showed that the nutritional states of elderly people can easily determined by monitoring the intake frequency of 10 food items shown in this slide. That is meat, food, seafood, egg, milk, soybeans, seafood, potatoes, fruit, vegetables, fat and oils. So we questioned about the intake frequency of 10 food items. As shown in this slide, in the elderly with taste disorder, excluding oil and fats, almost all ingredients intake frequency were significantly lower than in the normal taste this elderly. This result indicates that various ingredients intake may decrease due to taste disorders in the elderly. Well, in our taste outpatients, some patients complain of no flavor, although four basic tastes, sweet, salty, sour, and bitter, sensation were normal. We speculated that these patients' complaints might be due to decreased umami sensitivity. However, clinically, there was no umami sensitivity test. So, we developed the umami taste sensitivity test. Until now, the filter paper disc method has been used clinically in Japan as a test to the four basic tests: sweet, salty, sour, and bitter. Therefore, we used the filter paper disc method to develop the umami taste sensitivity test. An aqueous solution of monosodium glutamate, MSG, was used as the umami taste solution. This slide shows the distribution of umami taste sensitivity at the three different measurement sites. That is, the anterior tongue, the posterior tongue, and the soft palate, each for young and elderly healthy volunteers. The concentrations of the aqueous MSG solutions, that is, number 1 means 1 mmol, number 2 means 5 mmol, number 3 means 10 mmol, number 4 means 50 mmol, number 5 means 100 mmol, and number 6 means 200 mmol. The lowest concentration participants correctly identified was defined as the recognition threshold for umami. In the umami taste test we developed, the distribution of umami threshold in healthy elderly and healthy young subjects were similar. Next, we examined whether the umami taste can distinguish between taste disorder and normal taste. We applied this new test to the patients visited our clinic complaining of taste impairment. As shown in this slide, the test values before treatment were significantly higher than normal level. After treatment, each patient's test value became to those of healthy subjects. Consequently, we consider that this new umami sensitivity test could discriminate umami taste disorder patients from the normal umami taste subjects. This slide shows diagnostic performance of the umami taste test. Cutoff value of recognition threshold, which discriminate between normal and abnormal umami taste sensation, were as indicated by the red letter. 200 millimolar msg for the anterior tongue and 50 millimolar msg for the posterior tongue and the soft palate. Sensitivity and specificity also showed high value. Then the diagnostic accuracy at these cutoff value showed high value at each of the three measurement sites, as indicated by blue letters. Consequently, this umami taste test was confirmed to be useful for clinical evaluation. We have clinically used this developed umami taste test to patients with taste disorders. So we noticed that there were actually 16% of the elderly with taste disorder had umami-only taste disorder. Their sweet, salty, sour, and bitter recognition threshold were normal. All these patients complained loss of appetite and loss of body weight. The slide shows one case of umami-only taste disorder. Patient was 69-year female. History. For several months, food has become less palatable and appetite has lost, then body weight has decreased. A detailed gastrointestinal examination at the internal medicine clinic showed no abnormalities. Let's see her tongue, atrophy, and redness, that is glossitis, was observed on her tongue. We measured her recognition threshold each to 5 basic tests. So decreased, only umami sensitivity was observed. Also, the other 4 basic tests was normal. A blood test revealed that anemia due to vitamin B12 deficiency was the cause of her taste disorder. After treatment, umami sensitivity improved and palatability and recovered body weight. I will provide additional information regarding the patient's treatment. This slide shows her blood test results, etc. Anemia with megaloblasts, hyperdifferentiated neutrophils, and vitamin B12 deficiency were observed. So, pernicious anemia was suspected. We referred her to the internal medicine. We treated her for oral disease such as glossitis, and at the same time, her pernicious anemia was treated in the internal medicine. This slide shows another typical umami taste disorder case. A 78-year-old female on wheelchair visited our taste clinic with her family. She had poor appetite and loss of body weight. Her daughter was very worried about her bad healthy status. We applied her the umami taste sensitivity test. Upper table shows each 5 basic taste qualities sensitivity before treatment, and the lower table shows 10 months after treatment. Before treatment, only umami taste sensitivity was normal. After treatment, umami sensitivity improved and she regained appetite and body weight. To our surprise, after a year of treatment, she regained her health and was able to walk on her own. This slide summarizes before and after treatment of umami taste disorder. 1. Changes in umami taste value. 2. Changes in body weight. And 3. Systemic disease as cause of taste disorder. Many of patients with umami-only taste disorder were identified first time by our examination to have malnutrition-related systemic disease. Patients were not aware at all that they had these malnutrition-related disease. That is, iron deficiency anemia, vitamin B12 deficiency anemia, diabetes, etc. All of these umami-only hypoglycemia patients were accompanied by body weight loss and poor systemic condition. These systemic diseases related to malnutrition are also the disease accompanied by abnormality in oral cavity and tongue. This is glossitis and oral mucosal anemia in iron deficiency anemia. Iron deficiency anemia is accompanied with nail dystrophy, a spoon-shaped nail. This is Hunter's glossitis in vitamin B12 deficiency anemia. Then this is abnormal oral condition in untreated diabetic patient. A lot of white spots are candidiasis. The mucous membrane is dried and redness, and glossitis is observed. Most of these umami-only taste disorder patients had decreased saliva, dry oral mucosa, and oral mucosa release on the tongue and palatal mucosa. Treatments for dry mouth and oral disease, in addition to systemic disease, improved umami taste sensitivity, the recognition threshold for umami. Then patients also improved their appetite and body weight because food palatability regained and also improved systemic condition and their health. Decreased umami sensitivity causes nutritional deterioration. Impaired umami sensing might be a marker for detecting the malnutrition-related disease in the early stage. Next, I will talk about umami and taste disorder in young people. Do you think that young people have taste disorder? We investigated taste thresholds to each 4 basic tastes in freshman university students. As a result, taste disorders were observed in 24% of freshman university students. What was the cause of their taste disorders? We investigated the possible causes of their taste disorders. There were no differences in systemic disease, medication intake, or sleep duration between the taste disorder group and normal group. However, there were differences in dietary intake as shown on the slide. Blue shows everyday intake. Light blue shows 6 days per week. Green shows 5 days per week intake. Light green shows 4 days per week intake. Yellow shows 3 days per week intake. Light pink shows 2 days per week intake. Pink shows 1 day per week intake. Red shows no, not yet, not it. The taste disorder group was lower intake frequency of vegetables and meat than normal taste group. Meat and vegetables contain umami presenting ingredients. In addition, the frequency of intake of tofu and soybean, seafood, and seaweed, including kelp, was also reduced in the taste disorder group compared to the normal group. These are ingredients that contain a lot of umami substances. Meat, fish, and soybeans are foods rich in protein that build cells throughout the body, including taste cell. The turnover of taste cell is about 2 weeks, which is shorter than that of other body cells. So it is thought that inadequate dietary intake problem appear as taste disorder before they affect the whole body. Taste disorders, including umami, leads to appropriate food intake. Thus, a vicious cycle is created. Freshman university students have just started living away from their family and parents and tend to neglect their meals. We learned that new students need nutritional guidance. What kind of food do you think Japanese food is? Tempura or sushi? Ichiju sensai is said to be the basis of Japanese cuisine. It is a menu that combines rice, the staple food of Japanese people, with soup and 3 side dishes. This slide is typical Japanese food. Grilled fish, rice, miso soup with dashi stock made from kelp, fried egg, tofu, and tomato. There are foods rich in umami. Unfortunately, today's Japanese people are eating less Ichiju Sensai menu. I introduce you the interesting research conducted at the Faculty of Agriculture, Tohoku University. The students were divided into two groups. One group eating 1975 style Japanese food, that is Ichiju Sensai menu. And the other group eating the usual modern food, that is high in fat and sugar, Western food and fast food. As a result, students who ate our 1975 style Japanese food, rich in umami from various ingredients including vegetable, beans, and seafood, etc., less stress, improved motor function, and decreased BMI. It may be necessary to get umami from a variety of ingredients in one meal. In Japan, there is also a slogan of Japanese cuisine, Mago wa yasashi. In other words, the motto is eat beans, sesame seeds, wakame seafood, vegetables, fish, and shiitake mushroom in one meal. In Taiwan, there is probably a similar slogan of Taiwan cuisine. Eating a diet rich in umami has the following benefits. That is, umami creates feeding rhythm of meals. When umami makes us feel fullness, during a meal we stop eating. Also, umami does not stimulate the brain's reward system like sweetness does. So, persistent feeling of fullness elicited by umami after eating suppress hunger. On the other hand, obese American women had decreased umami sensitivity as reported. Sensation of umami taste may prevent obesity. Umami has health benefits for both young and elderly. For young people, stress tolerance, motor function promotion, appropriate BMI. For the elderly, appetite recovery, improvement of body weight and physical condition, immunity improvement. Finally, I talk about the application of umami to treat dry mouth. There are many different causes of taste disorder. However, dry mouth is a common cause of taste disorder in the elderly. This slide is our epidemiological survey to healthy elderly people about taste disorder. As shown, normal subject, blue column, showed normal salivary secretion. Normal level is indicated by this line. However, all of the taste disorder patients pink column, showed significantly decreased secretion. In taste disorder subjects, decreased salivary flow was shown compared to normal taste subjects. Dry mouth also is common among elderly people. Dry mouth causes not only taste disorder, but also mucositis, eating problem, and leads to malnutrition in the elderly. I will explain the mechanism by which dry mouth worsens taste disorder. 1. When saliva reduced, taste substances cannot reach the taste buds. 2. Degrees of saliva cause oral mucositis and damage the taste buds. 3. Degrees of saliva impairs regeneration of taste buds. The worsened taste disorder resulting from this causes loss of appetite and malnutrition. Also, dry mouth can lead to the difficulty to eat and swallow. Then, oral mucositis by dry mouth is painful and difficult to eat. This eating disorder by dry mouth result in malnutrition. Medication is used to treat dry mouth, but side effects such as nausea and tachycardia often occur in older people, so treatment may often be discontinued. How can we treat without side effects? We tried the sour taste medication. However, patients with dry mouth had stomatitis due to decreased saliva, then sour stimuli elicited pain. So we tried the umami stimulation. The umami stimulation reflexively increased whole saliva, similarly to the sour stimulus. Saliva is also secreted from hundreds of minor salivary glands presented in the oral mucosa, not only from a yellow saliva gland. This slide shows that saliva secreted from minor salivary glands on the lower lip. In patients with dry mouth, we clarified that decreased saliva in the minor salivary glands had a stronger effect than those in the major salivary glands. We investigate whether umami stimulation increases lip minor salivary gland secretion. Using cotton ball, each of 5 basic tastes was applied to the circumvallate papilla on both sides for 2 minutes. The saliva secretion was expressed as percent when the value before stimulation was regarded as 100%. The black line shows control, that is water. The red line shows umami stimulation. The blue line shows sour stimulation. As shown, sweet, salty, or bitter stimuli induce little increases in salivation as did water. Umami and sour increased a lot of saliva. The umami promoted minor saliva secretion was longer lasting than sour stimulation. Thus, umami stimulation was very effective to promote the reflex salivation also in the minor salivary glands. Umami stimulation has the potential to be a safe and secure treatment for dry mouth in the elderly. Our results are summarized. Umami taste sensation is useful to maintain nutrition and promote the health, both in the elderly and young people. For elderly patients with taste disorder, improvement of umami taste is important for improvement of nutrition and regain their physical health. Also, I'd like to express my sincere gratitude to Dr. Uneyama, Dr. Kawai, and Dr. Hayakawa for their cooperation in the development of umami sensitivity test. Thank you for your kind attention.
要大声一点，让他听到。Dr.
Thank you for your attention.
Dr. Satoh-Kuriwada, thank you for your interesting research. I think for most of us here in the audience, this is the first time we realize that the Umami testing may increase the nutrition in an alternative way and promote our health. Thank you so much. We appreciate it.
Thank you.
Thank you. Appreciate. 放很大。好，那在我们开